Hello everyone, my name is Grace Wu. Today I'm going to be sharing my study on the role of FOXO1 in osteogenesis during development under type 2 diabetes. In previous studies, it was shown that type 2 diabetes increases osteoporosis risk, fracture susceptibility, and impaired bone development. It's also associated with periodontitis, alveolar bone recession, and tooth loss. Four-cat box protein 01, which later we will call it FOXO1, is a critical transcription factor that regulates both bone formation and resorption. In type 1 diabetes, the expression of FOXO1 was significantly elevated, leading to decreased IFE80 expression and cilia formation, and thus impaired bone healing. However, the role of FOXO1 in osteogenesis during bone development under type 2 diabetes remains unclear. The aim of the study is to determine the impact of FOXO1 deletion on osteogenesis in type 2 diabetic mice by comparing bone microarchitecture and osteoblast activity between diabetic and non-diabetic control mice to determine the effect of FOXO1 in type 2 diabetes-induced skeletal changes. The central hypothesis is that FOXO1 upregulation in diabetic osteoblast progenitors impairs bone formation during bone development. Conditional knockout of FOXO1 in osteoblast progenitors will restore osteogenesis in type 2 diabetes. To test the hypothesis, the OsteoRisk-Curie transgenic mice line was used to specifically delete the FOXO1 gene in osteoblast progenitor cells in diabetic and wild-type mice. 4 experimental groups of 3-month-old mice were utilized. The femur of the mice were harvested at 3 months of age. Bone microarchitecture was assessed using the microCD45 system, and hemotoxin and eosin staining was used for bone mass assessment. This bar chart shows the trabecular bone volume fraction, which we will call BV to TV, of the 4 experimental groups. In the diabetic group without OsteoRisk-Curie mediated conditional FOXO1 knockout, BV to TV is significantly lower than in both non-diabetic groups. This is consistent with previous literature demonstrating that type 2 diabetes impairs bone development. In contrast, diabetic mice with FOXO1 conditional knockouts on osteoblast progenitors exhibited a significantly higher BV to TV. Following the knockouts, the difference in trabecular bone volume between the diabetic and non-diabetic mice is no longer statistically significant. This indicates that deletion of FOXO1 in osteoblast progenitors exerts a rescuing effect on trabecular bone volume in a diabetic setting. However, both knockout groups still show lower BV/TV than the wild-type control group, likely due to the variability in the wild-type data. So, additional samples will be collected over the next few months to further investigate this observation. Similar trends were observed for trabecular number and trabecular spacing. Diabetic mice with FOXO1 conditional knockouts demonstrate significantly higher trabecular number and lower trabecular spacing compared to diabetic mice without the knockouts. The effect is strong enough so that no significant difference remains between the knockout diabetic group and the wild-type control group. Trabecular thickness, however, does not show a significant difference among the knockout and non-knockout diabetic groups. This pattern is further supported by the 3D reconstruction of the femur. Diabetic mice exhibits markedly reduced trabecular bone density, especially in the midshaft region, whereas the FOXO1 conditional knockout restores trabecular bone density to levels comparable to the wild-type control group. Similarly, the HE staining corroborates these findings. The pink staining trabecular bone structures within the medullary cavity are more abundant in diabetic mice with the FOXO1 conditional knockouts compared to diabetic mice without knockouts, indicating a significant rescue effect on trabecular bone architecture. To conclude, type 2 diabetes impairs bone formation during skeletal development. Conditional knockout of FOXO1 in osteoblast progenitors significantly restores osteogenesis in the type 2 diabetes setting. Thank you very much for listening.